Hello everybody, I hope you all are doing very fine. So in today's video we will see one of the very important topic in our child health nursing career, that is pre-operative care of child and family. This has also come many times in exam, like 5 marks or 10 marks it can come. So basically it is as same that of the adult, but few of the things we will focus in this particularly to the child. So it will include a psychological preparation, physical preparation, protective measures, and preoperative teaching to the child and family. So first we will start with psychological preparation. During preoperative period of the nurse should develop trusting relationship with the child and the parents. The nurse should assess the level of understanding and anxiety of the child and parents and their coping abilities. These interventions include discuss about the type of surgery, explain the information to the child and parents, explain about preoperative medication which can cause discomfort. So here, since you can see it is a very simple language which I have put into sentences. So if at all any doubt or any queries you guys are having, you can always put into the comment section below. So moving forward, these are few of the psychological preparations. Okay, discuss about anesthesia and OT setup and transportation to the OT. Explain about limitation of diet and PO, that is nil per oral, at least 4 to 6 hours prior to the surgery or as directed by anesthesiologist. Do not remove favorite toys and other objects to prevent loss of security. Encourage child to play with cap, gown and mask and gloves with the dress doll. Assure the child that the parent will be nearby and waiting for him or her. Moving forward toward the physiological preparation, that is monitor temperature, pulse, respiration, BP, weight, skin rashes or any other abnormalities if it is present, and record the findings and report to the appropriate authority, that is a physician or the doctor or head nurse, whoever is present. If you see any abnormality in vitals or any of the complication or any skin rashes over the area which has to be operated, you have to inform the higher authority. So next is give nothing by mouth for the period prescribed prior to the surgery or at least 4 to 6 hours before the operation. Take the child away from the area where other children are taking food. Maintain good hydration. If needed, IV fluid therapy to be administered as prescribed. Make certain assurities that the prescribed preoperative procedures have been done, such as completion of investigation reports, anesthetic checkups, signature in consent form, then anesthetic dressing of operative area, bowel clearance, anti-tube insertion, hygienic measures, etc. has to be performed. Check for any loose teeth and secure the loose teeth, or you can remove it, or any dentures if they are present you have to remove, and also report and documentation has to be done. Then remove the nail polish and makeup if any present, eyelashes or eyeglasses. Then hearing aids may be worn to the OT but then taken to the recovery room and can be given to the parents to prevent its loss or damage. Ask the child to empty the bladder to prevent the bladder incontinence or distension. Administer prescribed preoperative medications in time. Encourage the child to cry or scream for the injection which is given to him. For the fear of the operation has to be relieved prior to the operation. Then transfer the child to the OT as in the given time and hand over the OT nurse with all the necessary things, records, reports and case sheet of the child. And also guys, here is one of the very important function. You have to identify and you have to mention the very necessary patient file which has to be given to the nurse who is working in the OT and who is taking handover of the child. So our third point is protective measure. Obtain an informed written consent for anesthesia and surgical intervention as a legal protection. So here informed written consent has to be taken, not oral. Written has to be taken from the parents. The next is check that all the laboratory reports, that is blood, urine, x-ray or any other test which is related to the surgery, has to be taken and should be mentioned in the case sheet. Then record complete information regarding pre-medical post-operative procedures, child's emotional and physical state to protect from legal problems. So everything has to be mentioned and documented to prevent from any legal problems during or after the surgery, if at all it occurs. Then third point is make sure that identification band for the child is attached securely to prevent faulty identification. That is the hospital ID should be on the child hand or bedside, or the identification band basically should be on the child. Allow one familiar person to stay with the child to avoid fear of strange. The child should not be left alone to provide a sense of security and emotional protection. There is a chance of fall and physical injury when pre-medications are given. So, protect from accidental injuries, the child should be attended by a familiar one. Make sure the child is sent to OT with documents and necessary precaution, as I have mentioned earlier also. So this all are the few basic precautions which we have to be taking to prevent all the legal problems. So we have focused basically on the psychological and preparation, physiological preparation and protective measures, and within that only we have seen few of the pre-operative teaching, like instructing the patients that nothing has to be given per oral, then all the medication, any side effects, everything we have to educate to the child as well as the parents. So that was all in this video. If at all this was helpful to you guys, please do like, subscribe and share. Thank you.